Can you please tell me what the Macmillan Toolkit is?
So the Macmillan Cancer Quality Toolkit is a project within the Macmillan Cancer Framework Programme. It focuses very much on service improvement and encouraging practices to look at their current practice and their processes internally, to review and then to reflect on what can be done differently and what can be improved upon. So the Cancer Quality Toolkit has 5 modules. The first one is around detecting cancer earlier, around screening. The second one is around prompt recognition and referring on for the investigations as quickly as possible. There's a third one about supporting patients through their treatment. And there's a fourth one about cancer care reviews and providing that holistic care for patients. And then the fifth one is about identifying and supporting people with advanced serious illness. So moving into end-of-life care.
The Macmillan Toolkit I describe it as an educational tool for GP practices. It's got a lot of functions. One is education, because each module there is a little bit of education and learning to be done. It also gives practices a chance to have a look at how they are working and audit their performance.
And there's still so much to do to improve cancer outcomes, which we know nearly always those improvements start upstream in primary care, be that through prevention, recognising signs of early diagnosis, access to diagnostics, supporting patients going through screening.
And what we've done is looked at other ways we could try and help GPs get faster access to radiology in particular circumstances. One of the things we realised was that we don't want people coming back and forth to the radiology department for repeat scans. Instead of having to have an X-ray first, if you strongly suspected a patient might have lung cancer, you could just get the CT scan done first as last.
When people have been diagnosed with cancer, the toolkit contains modules which encourage you to keep abreast of their treatment, to make sure it's properly coded, because unless the codes go on the GP software, it can be difficult to measure who's getting what and how many patients you have.
So I had acute lymphoblastic leukemia back in 2015. I was diagnosed. There are 2 read codes. One of them is what we call a morphology code. So it just describes a cell type. It's not a diagnosis code, and so the computer doesn't know that the patient's got cancer. So all of the clever tools that run in the background that says this patient needs a cancer care review and all of those sorts of things don't work. And that's how my doctor's surgery coded me. That's why I didn't get a cancer care review. For me, I didn't need a cancer care review. But if I'd been much younger and not known how to navigate, or if I'd been much older, vulnerable, any of those things could have had real sort of issue, could have been real issues for me. There could have been real consequences. So that's why the coding is important. It's really important that a patient's diagnosis goes on the clinical system, so the clinical system knows they've got cancer.
A simple step like making sure that the right code is used, for example, to say that someone has a diagnosis or that they've had radiotherapy, will help with counting. Proper counting means that services can be planned for appropriate numbers of people. It's also made me focus on how I do the cancer care review, and there's an awful lot of angles to that, which I feel I'm now doing much better.
We've introduced a system whereby when we're notified that a patient has failed to respond to bowel cancer screening, we now text them, and that has increased our uptake on that quite a big amount. We go through all of the new cancer cases, how that diagnosis came about, what we can learn from that, and none of these things would have happened if we hadn't been involved in the program.
Of the 415 GP practices across Wales, 76 are actively participating in the toolkit currently, and that includes completion of a baseline evaluation survey, submission of their action plans, and for 20 of those practices, they have completed the toolkit.
I think this is an exciting and innovative programme of work. It's been 5 years and it's achieved so much. We've had a fantastic team delivering this programme across the whole of Wales. So its impact has been immense. It's raised the voice of cancer patients in primary care. It's increased the knowledge and the awareness of the primary care professionals about what cancer patients need throughout their clinical pathway, a strengthened primary care voice into cancer strategy at a national level, and a strengthened primary care cancer voice at a local level as well.